today I want to welcome you to the examination room with Dr. Hall. Our special guest today is Dr. Savoy Brummer. Thank you.
All right. Today we have with us Dr. Savoy Brummer. I want to thank him for coming in to share his knowledge on the future of healthcare and how it's going to affect our newly oathed physicians.
Our Bison physicians, that's right.
Yeah, we took an oath to take care of patients, and we need to take care of ourselves and our finances. So what do you have for us today?
All right. Well, first of all, like I said, I'm really happy that that you invited me here. You know, the little tidbit about me is that I'm the vice president of a $1 billion healthcare organization. We see millions of patients, and we have literally thousands of physician jobs. And what we've seen after COVID-19 is that there has been a black swan event in medical care, and that this is really important for new graduates to understand that the landscape of getting a job has really, really changed. And what we want to talk about today is how it's changed, why it's changed, how long it's changing, and then, you know, give new residents, you know, the tools that they need so that they can be successful in this transition, especially amongst COVID-19. So, you know, I always like to say that when you look for jobs, there's the physician side and there's the hospital side, and hospitals have never been your friend, right? And I don't say that in a demeaning way, but the priorities of your hospital are always going to be different than the priorities of physicians. I always say you got 99 problems, but your new hospital that you're going to is going to be number one. It is your number one problem. Why? Because what COVID-19 has done is that it has created unprecedented losses in hospital volumes and revenue. And that's just in 2 months. So if you look at the entire economy, sometimes hospitals think that the entire economy can be falling, but somehow magically within medicine, we are immune to what the rest of the world is going through. And especially in this case, this is not true. What hospitals are seeing is that they're elective surgeries. And these are surgeries that people can come in and schedule that are not emergent. Hey, I need my hip replaced. I need a knee replacement. These things are really high revenue surgeries, have been completely shut down over the past 2 months. That is a hospital's highest revenue earning procedure. You've got the closure of non-emergent offices. So all these primary care doctor offices, dentist offices, everything has been effectively shut down over the past couple of months due to COVID-19. The loss of ER volume has been significant because people who are not sick with COVID are afraid to come in. I mean, and these are people who have heart attacks and strokes. These people are staying at home. But what's happening is that when you're in residency, you always hate getting those pages and those calls from the emergency part. You're like, oh my gosh, it's just more work. But when you become an attending, those calls become your lifeline. They're your revenue that come in from these referrals. And so if you're getting a 40% drop in your ER volume, those referrals have dried up. And again, you know, your offices may not even be open. And what has substituted, what's been replacing these ER visits are the rise of telemedicine, right? Imagine you and me right now, a doctor-patient interaction, and you're having these discussions, but telemedicine physicians get paid much, much less than an in-person visit, right? And that's kind of the theme that new graduates need to understand. So again, what are hospitals seeing? They're seeing a loss of $50 billion a month. 50 billion, estimates of $1 to $2 billion per day. My hospitals, I got one hospital in LA, you know, they're losing about $6 million a month. I know George Washington over in DC, you know, they've got about $30 million a month for the entire hospital. It just depends, but no hospital is doing well, right? And again, people are just afraid of COVID, and they're not going and utilizing the hospital in ways that we have never seen in the history of medicine, period.
And I just piggyback off of that, because I know that residents right now you think this doesn't affect you because you get your paycheck every 2 weeks. But what he's trying to relay to you is when you're outside of that protection bubble of residency, whether you're an employed physician that's asked to take a pay cut, or you are an independent practice and you go from an office visit that reimburses you between $200 and $300 a visit to telemedicine that could be as low as $25 on a visit. You can't supplement that income with telemedicine visits. You see 20, 30 people in office where they're, like I said, the revenue behind each one of those visits is between $150 to $200, $300, depending on their acuity, and flatlining and that's the thing, they don't grade telemedicine visits like they do in-person visits. You're flatlining at $25, $35, $45 of compensation per visit for telemedicine. That's going to hurt anyone's pocket. That's going to hurt the hospital's pocket. That's going to, as an employed physician, that's going to hurt your pocket as an independent practice. There's no way around that.
Right. And what you're going to see is that because there are fewer visits, this price pressure on physician compensation is only going to increase, right? And so here, what we were kind of talking about is that you have all kinds of different employment options, right? This is the traditional bread and butter. You have independent hospitals. These are groups that hire doctors directly. Then you have hospital-owned practices. Let's just say you own a big system like from Mercy or from Baptist, and they hire you directly. And then last, you have the locums opportunities where I always say you're like the substitute doctor, right? And there are pluses and minuses to all of these. Typically in independent practices, you're more likely to be an independent contractor more than an employee. These independent practices can be big or small. They can be outpatient versus inpatient. I would say typically they're a little bit higher paid than a hospital-owned setting because they're a little bit less stable, right? So you have the whole risk-reward type of thing. And they're a little bit more tax efficient, again, because they are independent contractors. Then you can go to a hospital-owned job where you are right now, right? So residents are actually hospital employee. You get your check every 2 weeks. They're typically larger. Again, they're a little bit more stable, but you have a contract term, right? So typically as an employee, you sign up for a 1, 2, or 3 year contract. And at the end of that contract, you all go your mutual ways. And then over in locums, again, they're typically independent contractors. It's a month-to-month type of thing. It's a supply and demand type of thing, right?
And so it's very dependent on specialties. Some specialties do extremely well in locums. Typically more shift work like ER and anesthesiology, where you walk into some situations that can be very, very lucrative. And other hospitalists, OBGYN, there are it's very, 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 very dependent on specialty as far as what locum tenens opportunities are out there.
Right.
Fortunately, my specialty is very locum friendly, but that's not the case for pediatrics or other specialties and subspecialties.
No.
So be aware of that as well.
Right. And again, we all have our biases, right? I mean, the other thing, on independent practices was a partnership. That's when you own your practice. Typically, when you own your stuff, you get to have residual income from the work of others, right? So I am a partner for my company, right? And it takes a longer time. So I'll say, oh, it's great. But we're not trying to tell you folks to choose any of them. This is just like an overview of you all just understanding the world that's around you. Because as you will see, post-COVID world, things have changed, right? And what we're going to do here is just give you just some highlights of some very specific case examples of how you can see these employment settings. So Envision is a large independent practice that staffs anesthesiologists, hospitalists, emergency medicine doctors, radiologists, surgicalists, large number of specialties throughout the acute care continuum. But these folks typically are owned by the stock market or private equity. They take out a large amount of debt so that they can continue to manage effectively and to increase their share price. What these doctors did is that they have a large ambulatory surgery section for their group. They saw a 90% drop in their ambulatory surgery section. So a large number of anesthesiologists, who again is one of their largest revenue centers, weren't working. So they saw their ER visits drop, their outpatient visits dropped. So they had to cut their hourly, and they had to cut the number of hours that they were working. Again, in 2020, they didn't pay the 2019 bonuses that were due to doctors.
Wow.
Right? And then the doctors had to take an additional, for 2020, 20% pay cut, because Envision couldn't pay the loans to all of the private equity shareholders, right? And they were on the verge of bankruptcy, and only now did they restructure their debt, but the doctors are still going to have these problems, right? So the doctors are what you consider the tax center. They are the cost center, I should say, for these hospitals and for these groups. And so these doctors are taking literally a 40% haircut across all specialties. All right. You're like, well, yeah, that sounds awful. I'm going to go and join a hospital-owned group, right? And be an employee. Bond Secures. This is down in Virginia and in North Carolina. These folks were furloughed. So furlough is when they basically tell you, we're not going to take you to work and we're not going to pay you. And they did that. Again, they're in the process of that for 3 months. So not only was your pay cut, they just said, we're just not going to pay you for 3 months. So again, it's one thing when you've been out in the game, you stacked a little bit of cash, and you have some cash reserves to live on. Imagine if you're a new grad and you took a job, and within the first month of taking that job, and you got loans and you just bought a house, and they say,
you got a car. I know you got, even though I told you not to do it, you bought a car.
you got a ride. And you say, we can't pay you for 3 months. And you know what? We're not going to guarantee you that we're not going to extend this furlough for a longer period of time, right? So this is creating, again, a lot of employees will say, well, you can't do that. I have a contract. But in many of these contracts, you have an act of God statute that dismisses all of the relationships that you have if some unforeseeable act of God occurs, and it protects your employer. COVID-19 is that unforeseeable act of God, right? And so you can be very much so limited, and that's what hospitals have been using for that.
Can I just say something I just found out? Residents and fellows aren't protected from this. They are not.
Yeah.
You could actually show up for your residency or fellowship on July 1st or at the end of June, whenever you're supposedly starting. And if we are having that second spike again, especially since the graduate medical education, the ACGME is getting involved to protect residents from exposure, actually. And actually, some residents are not considered essential. They can furlough you. They can pause your residency training. So you're not only are they taking your monthly stipend, but that extends your time in residency and fellowship.
Yeah. And I would say the only thing is, there was a thought that younger people would be more immune to COVID-19. So, I went to undergrad at Howard. I did my training, or actually I went to med school at NYU. NYU was throwing a bunch of medical students at the problem, right? And throwing a bunch of residents. And then those residents and medical students were getting sick too. So there's been a lot of discussion as to how we utilize folks, but the whole point again is that there's very little protection. And in general, when you look at locums, because of the short-term contractual nature, they are typically the first to go, and the per diems, the part-time work that, for example, I may have a full-time job at one hospital, but then I have part-time work, at other places. These contractual relationships are more limited in scope than hospital-owned and independent practices. So a lot of these locum companies have actually been filing for some of these healthcare loans as well. right? So so all this sounds like, doom and gloom, cats and dogs living together, the end of the world as we know it. There are certain things that we're not trying to disparage you. We're just trying to educate you, because this is a temporary problem. This is something that, you know, like the stock market. Sometimes things go up, sometimes things go down, but ultimately we deal with this. So the moral is that competition for jobs will increase. We have more residencies than ever before. We have more advanced providers who are nurse practitioners and physician assistants that in many specialties can help with the workload that was thought to exist. And then we see telemedicine, it's only in its beginning stages, right? So understanding that the marketplace for your jobs is only getting worse. So these are some things to consider. The first is, it's like buying a house: location, location, location. And again, I hire physicians across the country in different states, and what's going down in Texas is different than what's going down in DC. Yes, I know. What's going down in LA is definitely different than what's going down in Louisiana. And so please be flexible in your first job, right? Please understand, everybody's got your own financial situations, but at least understand that location will have a more profound effect on your job opportunities than ever before, especially if you're coming out, I would say, in the next 2 to 3 years. Pay cuts are inevitable. Please do not ask your friends what they make right now and expect for that to be the bar, okay? You need to plan wisely. You need to continue. I understand, you've had this delayed gratification thing, but you need to go and plan your financial, model so that the next 2 or 3 years, we have some turbulent waters. Let me maintain a lifestyle which is appropriate.
Don't buy that new car. I always tell them that. They never listen.
I know, the ride, man. You got to hold off on that. Establish relationships early. Okay, so these are the things where, when you have folks that are job creators, right? I mean, it's one thing just to talk to your mentors that are working over at your particular institution, because right now you probably think that these folks who are over at your hospital are the biggest thing ever. But when you get out into the real world, you got to start understanding who are the medical directors, who are the regional directors. Correspond with them, right? These are the people that can make job opportunities for you later on. Okay, that is very, very important. And I tell folks this all the time. And for me personally, I always want to put, you and I always talk about how I want to go and put Black people in positions where they can be successful in leadership.
Put me in the game, coach. Put me in the game.
Oh man. Look, I already have thoughts for you, because I already talked about El Paso and Houston, what I got down there, right? Okay. So if you're an independent contractor, we want you incorporated. And the reason is, it's going to help protect you and give you opportunities from government programs. Understand your contract. Like I said, a lot of people think that these contracts mean that no matter what happens, if I'm an employee, I'm guaranteed, shifts, hours, and pay. That is not the case. All right. It doesn't matter what's said in there. There are, again, acts of God provision which protect the hospital for situations such as this. I want everyone, when you take a job, I don't care if it's with a independent group or as an employee, you understand the financial condition of that hospital, because hospitals even support these groups that are hiring you, right? So you need to understand, if you're going to a hospital that's been really, really shook by this, try to gain some insight as to what their longevity is, okay? Because I'm not saying to not take jobs in places that have been especially hard hit, but you just need to be aware, right? Risk mitigation, understand the situation that you're walking into. Accept your job offers earlier than before. Do not be so set on this one location in this one city that you really, really want to work. If you get a job offer in a location that you like, take the job. Don't have so much hubris that you can't see the forest from the trees. Consider alternative jobs. If all else fails, if you really want to live in New York and you got to take, and you can't find, for example, an emergency medicine job, think about telemedicine. Sure, it pays a lot less. It's a lot, it's a lot more complicated for you, but sometimes you got to do what you got to do, and you have to just, think outside the box. It's not a bad time for a fellowship or advanced degree. If you're considering going to get your MBA or doing a fellowship in a gazillion different things depending on your specialty, a couple years of education and increasing your value is never a bad thing. And then just remember, it's only temporary. Medicine is still a great job. It's a wonderful opportunities that you have. It allows you to have a platform, and have a gazillion different followers who just, who you can meet every day. But it really provides you great opportunities. And I know you've got some other some other thoughts for residents as well.
First and foremost, when you were talking about established relationships early, any Howard grad, once you leave the College of Medicine, you need to connect with our alumni. I got my shirt on too. You need to.
But you know what? They can't say that they don't know anybody, because you've got.
Listen, this is an introduction. They are going to flood your inbox. They're going to be sliding in your DMs. They're going to be following you because, this is one of my rich friends. I'm telling you. Like him and Puff Daddy, like he just did a live with AJ, like he in Hollywood. This is one of my rich friends. They're going to follow you, but you need to be specifically connected with a medical alumni association. There's no reason that you are in any city in the United States of America and you don't know experienced physicians who have this wealth of knowledge that they can pour into you and guide you when you're trying to make these decisions. And also, my Howard alumni have been a lifeline to me, not just in medical school, but since I left. And my second advice to you is to get involved in the global discussion. You should know everything that's going on as far as advocacy for student loan forgiveness. I know for a fact my Howard medical students are graduating with more than $250,000 worth of debt just from medical school, not to mention if they took out loans for undergraduate, postgraduate, and graduate degrees. You should be very involved in that global discussion of student loan forgiveness, and not just student loan forgiveness, but how all of these global issues are affecting your career. We live in this bubble trying to get through medical school. You live in another bubble trying to survive residency, but you cannot have tunnel vision when it comes to healthcare. Healthcare is a global discussion and a global issue now. So be a part of that global discussion. And if you don't advocate for yourself, no one else will. So right. Petitions that are out there being signed, know who your politicians are, know their connection to Howard, because I stay in Kamala Harris' inbox. And I know she probably thinks I'm annoying, but at least she has made it a point to bring student loan forgiveness to the discussion of recovery and relief from COVID. So you have to be involved and you have to advocate for yourself, and you need to not be so proud as to not reach out for advice and help. It's not a handout, it's a hand up. I'm here, I'm always available. I know Dr. Brummer is available because I troll him on social media and he still responds.
He's funny. You know what? Let me tell you, like I said, Howard, even the people who work at Howard, right? My company is called Vituity. We staff all these places. We staff Howard Hospitals, the emergency department. Dr. Maureen Bell, who's the chairman, is a partner in my group. Like, the people who you're walking around every day are people who truly care about you all. You know what I mean? And we talk all the time about all we want. Like, I'm good. Look at it. I didn't buy a car. I see that. I bought an original Dolly instead. I understand about depreciating assets, right? So look, let me tell you something. Like, this is not the time to be irresponsible as a resident. And this is our way of giving back to you guys. So you all can reach us. Again, my name is Savoy Brummer, right? And you all can call me, text me, find me on Instagram. It doesn't matter. I'm always available. And I try to make sure that I reach out and stay connected with folks and give them really great job opportunities if they're available.
That's right. Be sure to follow Dr. Savoy Brummer, the Savvy Doc, on Instagram and email him your questions, savoymd@yahoo.com. Subscribe and hear more from us later.